Hello everyone, welcome to the channel. In this video we will talk about systemic bacteriology, which will help you in neetpg and also your mbbs exam. Alright, so systemic bacteriology. First of all, we will talk about gram-positive cocci. So there are two types of gram-positive cocci. The first one is Staphylococcus. Staphylococcus. And the other one is Streptococcus. Alright, so how can we differentiate between these two? Which one is Staphylococcus and which one is Streptococcus? For that, we have to do catalase test. Okay, so what is catalase test? In catalase test, generally we use 3% of H2O and culture growth. If oxygen is released, it is positive, and positive means Staphylococcus. And if oxygen is not released, it is negative, which means Streptococcus. So that's how we can differentiate between Staphylococcus and Streptococcus. Alright, so now we will talk about Staphylococcus. Staphylococcus. So there are two types of Staphylococcus. The first one is pathogenic and the other one is non-pathogenic. So how can we differentiate between these two? So for that we need to do coagulase test. Alright, so for if it is positive, coagulase test is positive, it is pathogenic Staphylococcus, and if it comes negative, it is non-pathogenic Staphylococcus, which is also called cons. Cons means coagulate negative Staphylococcus. Alright, coagulate negative Staphylococcus. Alright, which is called cons. Alright, so what are the examples of this pathogenic? There is Staphylo aureus. For non-pathogenic, there is Staphylo saprophyticus, and also Staphylo epidermidis. Another one we can write Staphylo lugdunensis. Alright, so we'll talk about non-pathogenic. How can we differentiate between Staphylo saprophyticus and Staphylo epidermidis? Alright, for differentiating these cons, we have to do novobacin test. Alright, novobacin is antibiotic. So novobacin test. So if it is novobacin sensitive, which means it can kill bacteria. If it is novobacin sensitive, it is Staphylo epidermidis. Alright, and if it is resistant, it is Staphylo epidermidis. Staphylo saprophyticus. Alright, so that's how we can differentiate between Staphylo epidermidis and Staphylo saprophyticus. Alright, so this is general classification of gram-positive cocci. So you have to remember, first of all, we have to do catalase test to differentiate between Staphylococcus and Streptococcus. After we find out that Staphylococcus, if you want to differentiate between Staphylococcus pathogenic and non-pathogenic, we have to do coagulase test. And if you want to differentiate between cons, so we have to do novobacin test.